As a good manager, it is imperative for you to take inventory. So this may not be a company, but you see yourself, see your entirety as a company. And truthfully, you are a company. You have spirit, soul, and body. And the proper management of these three entities would make you become who you want to be and how you want to be and how people is going to see you. So it is for you to see yourself in the correct image, in the correct likeness of what you want to become. Physically, you need to take stock of what you possess physically, of what you possess psychologically, of what you possess spiritually. And why? The reason is because you would be able to make a critical analysis of yourself, to know your strengths, to know your weakness, and to know where you should reinforce. Okay, you should be able to do this personally. After this episode, you would be able to look into the mirror and practicalize it. Okay, physically, you need to take inventory. And we'll be using this method, the region of skeleton in the body. So we look at the axial skeleton and perpendicular skeleton. So for the axial skeleton, we look at the head, the neck, and the trunk. So the trunk contains your chest, your abdomen, and your back. And the perpendicular skeleton talks about all the attachments to the trunk or to the axial skeleton, which include your pelvis or your pelvic and your limbs, both upper and lower limbs. So let's start. You look at your head. Okay, so I would like you to pause this video now, grab a mirror, just be listening. Look into your mirror now. Look at your eyes. Which type of eyes do I have? Is it white? Is it dark? Is it brown? Is it blue? You need to look at it. How does it look like? What's the shape? Is it bulky? Is it tiny? You need to take inventory of how it looks. Why? Now let me give you a reason why. It is common that someone would talk to you about your eyes, that your eyes is too big, and you see it as an offense. Whereas the person is not telling you what is not real. That is how you look. So you need to take inventory so that you can come in time and journey with this mirror therapy to a state that you become who you are. Okay, so you look into your eyes. How do you look? Is it symmetrical with the ears? Okay, so you look at that. You look at your eyebrow. You look at your nose. Is it dome? Is it flat? Or is it pointed? Look at it. Look at it. You can smile. Look at your nose. Look at your lip. Is it flat? Is it big? Is it like donut? Is it pointed? Is it wide? Is it tiny? Is it so you look at it, look at your teeth. Is it well set? Is it like cricket teeth? Is it gapped? Look at it. Look at your tongue. How does it look? Look at your mouth. Look at your buccal cavity. Look at how it looks. Look at the back of your teeth. Look at how it looks. You should know what you have. You should know how you look. So you look at your head. Look at the shape of your head. Look at how it looks. Look at your ears. Is it small? Is it big? Is it wide? Is it pointed? You need to look at those things in the real sense of how they truly look. So look at the back of your head. You know, there will be a time someone will tell you, "Oh, your head is too small," and this may make you to start to body shame. So you look at your neck. Is it long? Is it wide? What's the shape? What's the color? How does it look? Is it bent? Is it straight? Look at that. Look at your chest. You may be alone. You can look at your breast. Look at how your chest looks like if you're a guy. Look at how the muscles of your chest looks like. Look at your abdomen. Do you like what you see? Maybe you are looking for a flat tummy, but no, it's like a ball, or it's like you're pregnant. Look at even if you are pregnant, look at how you look. Look at your abdomen. So after you look at that, your back is also important. Look at how your back looks. There will be some times you will be home. Maybe you just pull off your clothes. Let's, for example, you are married. You don't even know how your back looks, but your partner will be seeing that and would have that at the back of his or her mind, seeing how you look, but you don't know that. So try as much as possible to look at how you look at your back. so that you would be able to know how you look, what to work on, and what to improve on, and what to reduce. Okay, so that is one of the reasons. And now on the perpendicular skeleton, look at your limbs. How many fingers do you have? Which type of nails do you have? Is it, look at your semen crease? How does your hands look like? You need to check that. Okay, you need to check all those things. So you look at your palm, you look at your fingers, you look at your elbows, you look at how everything looks. Okay, you look at your armpits. Oh my goodness, I can't overemphasize that. Look at your armpits. Look at how it looks. Is it hairy? Is it dirty? Is it smelly? Take inventory. Okay, take inventory. Look at your scars. Like for me, I have scars on my right elbow. Look at it. Take inventory of it. Okay, you know what you have. Look at your legs. Is it big? Is it tiny? Is it thin? Is it, look at your calcaneus. Look at your lateral malleolus. Some, like mine, is protruded. It's, some are flat, some are robust, some are filled with muscles, some are filled with bones. Look at how it looks. Okay, look at your leg. Is it long? Look at your foot. Is it long? Look at your toes. How do they look? You need to look at them and see how they look. Some, it will be an abuse when they see a picture of how their legs look, but they don't know, is that my leg? Am I sure? Is that my leg? So you need to take inventory. Study how you look. I need to make this clear. This is not for you to be body focused, but for you to become who you want to be and appreciate who you are. Okay, so and overall, you need to look at how you look generally. Okay, so you can rate yourself. Oh, I look good. I don't look good. But the aim of that inventory is so that you can know what you like, what you don't like, and it will make you to know what to work on. Then we'll be able to look into this in other episodes. Okay, so let's go to the psychological inventory. I am Isaiah.